Hi everyone, thank you for joining us for our fifth and final webinar on the connections of disability justice and sexual violence prevention. My name is Sky Gantala and I'm here from the Multicultural Efforts to End Sexual Assault. Our webinar today, our last webinar in this series for this year, is kind of culminating all of the different topics that we have discussed so far. And so our topic today is preventing violence against people with disabilities. I just want to again say that I'm really appreciative that we've had organizational support from so many different agencies and disability advocates, including obviously MESA, the Indiana Coalition Against Domestic Violence, the Indiana Coalition to End Sexual Assault, and the Indiana Minority Health Coalition. We have an amazing group of co-presenters today. And each person is going to introduce themselves whenever they get to their section that they're discussing. So I'm going to be just starting us off today. And just so folks can have some photos of folks of the co-presenters, each person's photos will again come up whenever they get to their section as well. So our co-presenters today are myself, there's a photo of me hugging a goat, Jody Powers, Andrea Mann, Haley Summer, and Sierra Olivia Thomas Williams. So the topics that we wanted to get through today are talking first about the importance of dismantling ableism. I think this has been a pretty consistent theme throughout our webinar, but we just really want to hone in on what this looks like so that we can support folks in really applying what that looks like and how to replace ableism with disability justice. And then Sierra and Haley will talk about at the organizational level how to do support agency and consent for and with people with disabilities. We'll have a brief section on connecting the dots between disability justice and other forms of structural violence and wellness. And then we will end with Andrea and Jody talking about how we can move forward and create positive social change and disability justice in a really applied way in different situations and in different capacities. This next slide is just a photo again of our overall webinar flyer that talked about when each of the webinars took place. This is the last one for this year. We really hope to be funded again to get to do more of these and in more depth and detail. Everyone at the table is silently cheering because we've had a lot of fun putting these on for everyone, and we really hope that we get to keep working together on this. Okay, so the first section we're talking about is square one, the importance of dismantling ableism. There's just a photo of me wearing a breathing mask on a walk with my little orange dog who loves going on walks with me. So one of the things that I wanted to bring with me today is the voices of several people of color who are important leaders in a variety of social justice movements. So I'm just going to read a few quotes that I think have a lot to do with what we've discussed over this past year. The first quote comes from Bell Hooks. The first act of violence that patriarchy demands of males is not violence towards women. Instead, patriarchy demands of all males that they engage in acts of psychic self-mutilation, that they kill off the emotional parts of themselves. If an individual is not successful in emotionally crippling himself, he can count on patriarchal men to enact rituals of power that will assault his self-esteem, end quote. I also just want to note that I don't necessarily personally think that it's an appropriate place to use the word crippling, that is like an ableist slur, but hopefully you get the point from Bell Hooks that very often in order to support violence against marginalized people and communities that often society expects people from dominant positions to harm themselves in that process as well. The next quote comes from Alok Vaid Menon from a piece of writing called Femme in Public that they published in 2017. Quote, "What feminine part of yourself did you have to destroy in order to survive this world? At what point does femininity become synonymous with apology? Who hurt the people who hurt you? Let's figure it out." Alok is also a very amazing artist and trans femme person of color, and I highly recommend following them. This is just a slide that we've had pretty much throughout the webinar series where we define disability justice as moving beyond just legal to what Nia Mingus calls a framework that centers justice and wholeness for all disabled people and communities. I, as you can probably tell, am a huge admirer of Mia Mingus, so I have a few quotes from her as well that are specifically related to disrupting ableism and creating communities and cultures where disability justice is valued. So some of the things she says, and this is actually from her WordPress blog called Leaving Evidence, and it's this incredible speech she gave in 2011 at a Women of Color conference called Moving Toward the Ugly, a Politic Beyond Desirability. So that's where all these quotes come from. The first thing she says is, it can be very dangerous to identify as disabled when your survival depends on you denying it. That's end quote. That's just something that always gives me chills, because she really gets to the point that being able to talk about disabilities for people who have disabilities is inherently a very personal and political statement and process. Another quote from her says, I was femme before I was queer. I was grappling with how to navigate gender as a tiny Korean transracial and transnational adoptee disabled girl, queered by my physically disabled body. I grew up in a feminist community around other powerful femmes of color, but none of whom identified that way. There was no word for it. It was just their life. Their gender was about being a grounded force to end violence. Their gender was about forging dignity out of invisibility that could slice through femininity, that would rather be pretty than useful. Their gender was about answering the question, what is the work you're doing to end violence and poverty, not what shoes are you wearing? Their gender was about feeding family and raising children collectively, organizing for themselves when no one else would. Their gender was a challenge to the world they lived in that was trying to erase them. And then end quote. And then a final quote from Mia Mingus says, as the generational effects of global capitalism, genocide, violence, oppression, and trauma settle into our bodies, we must build new understandings of bodies and gender that can reflect our histories and our resiliency, not our oppressor or our self-shame and loathing. We must shift from a politic of desirability and beauty to a politic of ugly and magnificence. End quote. So I just really wanted to make sure that we were highlighting a lot of the work of various queer and trans, particularly people of color, and I really hope that you will take the time to look into other folks' work, because we cannot possibly encompass all of the amazing work that other community folks are doing across the globe on these topics. So in thinking about how do people actually do the work of dismantling internalized oppressions, particularly around ableism, which is what we're talking about in this series. And I want to encourage people to start with asking yourself a couple of questions. The first is, how would you feel about yourself if you were unable to do something or could do something in ways that were not accepted? So thinking about, what would it look like to move with a mobility device, or to not be able to drive, or need assistance in getting transported from place to place? What would it look like to go to the movies and, require like something that included captions? I don't know if people are familiar with this, but a lot of times if you require captions, theaters don't invest in caption glasses. So instead, they give you something that you put in a cup holder that's really visible to everyone around you. Accessing restrooms, sometimes restrooms have very cursory accessibility options, like an accessible stall, but what would it look like for an older child or an adult who actually needs to be able to lay down on a surface? Oftentimes, older children or adults are not supported in having space to lie down if they need to take care of their bodies. What would it look like, for you if you didn't have the same level of physical strength, if you needed more support in doing things that required certain types of physical strength, or if you couldn't pay attention in the ways that people expect you to? Particularly one of the most probably prevalent ways I see this happen is, what if you literally couldn't work an 8 hours a day all at once? That completely reframes, how do you survive? How do you make money? And then, of course, in terms of communication, what would that look like? And this kind of gets us to the point where we think about, like, the second question: when have you ever felt ashamed of taking care of yourself? I think this really cuts to the really personal ways that ableism impacts us, because very often people just generally are expected to ignore their body's needs or their emotional needs for the sake of survival, for making money. And so if you start there and think, if I had to do something in public, or if I had to take care of myself in a certain way, would I feel shame, and what would that look like? And that, I think, will point you in a direction of some of the areas that you can begin working on this. Okay, so just a few steps in terms of how, now that we have kind of a framework for thinking about how do we even identify internalized depression, and particularly ableism. So here's just 4 ideas for how to get started with actually assessing and moving forward in that. So that's a typo, it should say test out, not test our, different ways of moving through the world. So, and I want to be clear that what I'm saying is not that by moving through the world for a short period of time that you are going to understand what it's like to live with different disabilities, but I think it will greatly enhance each person's knowledge of how different people with different mobility and life needs do move through the world. So considering, what would it look like to get on public transit, or try to, utilize ride shares or something like that if you had particular accessibility needs that are not readily available. What if you just for a single day tried to only use accessible entrances, or only go in accessible buildings, or only use accessible restrooms, or restrooms that had accessibility needs available? Do some research on different types of sensory support devices and apps. What does it mean if someone is nonverbal? How do they communicate in the world? What would that look like? Does it cost money? The answer is yes, it usually costs money, by the way. But just figuring out, what is it that somebody goes through if they have these needs that are not socially accepted or supported? The second point is noticing when you do feel ashamed for self-care. This is kind of a universal. I think almost everyone experiences this at some point, at some point in their lives. So if you feel ashamed for self-care, if you're able to, do it anyways. Take care of yourself. And then if you get to the point where that feels comfortable, do it more visibly. And notice also when your ability fluctuates. That's really important because ability is often fluid and impermanent. We've mentioned this in previous webinars, but there's often this perception that ability or having idealized ability is permanent, and somehow disabilities are unusual or less common, when in fact, typically people's abilities are going to shift throughout their lifetime, and it's more rare and unusual for someone to have an idealized set of abilities for their entire life. The third point is just getting involved in disability organizations, getting to know different folks with disabilities. And then the last point is practice violating social norms in positive ways and sitting with the discomfort, because very often being able to engage in discomfort builds up your own resiliency. It will make you a better advocate, because advocacy is rarely comfortable. Ask more questions of people and give people more grace. So what I mean by that is, recognizing, for example, I presented in a out-of-state space recently and was talking to folks about wearing headphones everywhere, and also being worried that people would think that I was being rude and ignoring them, or listening to music, when in fact I was just trying to not be able to hear the incredible levels of sound that were happening all over the place with hundreds of people converging on the same space. So recognize, people are doing their best to take care of themselves, and give them the benefit of the doubt if you're unsure what's happening. Okay, so a few points specifically on replacing ableism with what we're calling radical self-care and community care. And so that means involving people with disabilities in leadership, reimagining decision-making processes. Don't assume that everyone can contribute to decision-making in the same ways. Redefining self-worth outside of productivity. And then I really want to encourage people to throw away the idea of, quote, intelligence. Intelligence is, I think, often used as this assumption that there's only a single type of intelligence, or only one type of intelligence that everyone should have, or otherwise they are not intelligent. Instead, recognizing that everyone, it's much more enjoyable to go through life with the curiosity to learn about different people's skills and gifts and compassion and the things that they can bring to relationships. The last point I have is considering your actions and life choices in the ways that they impact you, your loved ones, and the entire community. So, moving away from this idea that each of our actions only impacts ourselves. It impacts everyone, because none of us is an island. And so thinking about, like as you're going through life and making decisions, how does this impact the larger community, and how can your actions better support not only you, but the entire community that you're in? And similarly, like, what do you need? Take time to daydream. Like, if the community actually supported you in the ways that you need, what would that look like, and how awesome would that be? And how can you contribute to making that a reality where the community actually does come forward to support each other? Okay, so now we're getting to agencies and consent. And before we do that, I'm just gonna say that I got excited as usual and I forgot to actually introduce myself. So I said that I'm from Mesa. I also wanted to say that I'm a white, queer, and trans person who is autistic and has other disabilities. And I'm gonna leave it there because I've gotten to speak at lots of different sessions. But okay, so I think Sierra is coming now, and we're just gonna leave the computer and move. They can yes, I just moved it down.
Oh, okay. Cool. Hello, everyone. So nice for you to see me. I was going to say nice to see you. Like, wait, that doesn't work. I'm Sierra Olivia Thomas Williams, and I am the prevention specialist at Indiana Coalition Against Domestic Violence. And I identify sometimes as gay, most times as asexual now. I'm a parent of I'm the single parent of twin 16-year-old people, and also a member of the Tumile Nisenan Miwok, and I am mixed. My mom is white. I use she, her, and her pronouns if you want to email me or address me in some way. And I've been in the field for going around 20 years now. I spent about 18 solely doing sexual and domestic violence advocacy in crisis centers. And so, okay, I'm going to get into my content now. So I wanted to start in this very familiar place. I feel like for most of the people who are joining our webinar right now, we've thought about and probably talked a lot about consent. And I wanted to bring it into the conversation just as a reminder for us to kind of trouble the way that we have been doing things and bring nuance to the argument. And so what I'm showing you right now is the Planned Parenthood consent fries: freely given, reversible, informed, enthusiastic, and specific. All really wonderful aspects and element of the social contract of consent. And last time I talked about it, I was quite angry at the time, actually. And so what I want to talk to you about today is kind of some of the things, the reason why I was so angry. So when I think about consent and what I recognize about consent and the way that it is used legally is that most of our states don't actually define consent or like consent in the positive. Rather, what we do is we have an outline of the absence of sexual consent, which is codified in our rape laws. And so we don't actually, so we've got the shape of a problem, but we don't actually have a clear idea of what the solution is or what the alternative behavior would be. And I was really interested by that because it messes with my mind when I think about, like, consent is so positive and active. So for this legal definition to be so, it's lack. It's nothing. It is in its absence when consent isn't there. That is how it's legally defined. It messes with my mind. So I wanted to think about that a little bit. And I found this really great tool on the RAINN website. It turns out that they actually have a tool there where you can go and see if your state defines sexual consent. And what I mean by that is, yes, all of these states have rape laws, but some states actually include in the definitions of either the criminal code or in some cases just the common law, which as I understand it, does not necessarily mean criminal law, where they define consent. Every state does it differently. Not many states do it. You can see here, I put together a map. There's only 20% of the states in the United States do it. And what I mean by that is only 20% of the states in the United States define what sexual consent is. The states there with an asterisk are states where they have affirmative consent laws, which is a little bit different. And if there are people on the webinar who have affirmative consent in their states, I would love to hear from you. I want to show you this tool really quickly, the database, because it can teach you a lot about disability actually, and how your state deals with disability. So I'm just gonna, I'm gonna select California because that's where the tribe is. And then for the sake of time, Alabama. And then I'm just gonna select consent laws, and I want to show you all of the information that comes up. There's a little doohickey in my way and I can't scroll. Do I use the arrows? I'm trying to go up and down. Okay, there we go. Okay, sorry folks. Okay, so what you're gonna see is, so you can look at 3 states. You get to see how consent is dealt with, if it is dealt with. You can see, you can see the codes where they include it, the ages of consent. What's great about this is it also explains what happens with young people, elders, and people with disabilities. And so you can see that some states don't deal with disability. They don't bring disability into it. Let's see. And so there is a lot of information on this website that I hope that people will take advantage of and look into to educate yourself and, you know, the people you talk to about how your state deals with consent. I wanted to show this. So Indiana does not define consent. Indiana also does not have affirmative consent. So I wanted to bring it up because it's new. It's quite new. I think that people started doing it, I want to say in 2014 is when, and you can correct me in the chat. So it's a relatively new thing. I think, well, the last slide will tell you which states have it, but this is specific to sexual consent, and it emerged from campus-related prevention. As I understand it, affirmative consent in some states is only applicable in college settings or college and school settings, and that is it. But some states also have affirmative consent, like open, and it doesn't require a context of a school or a job like our Title IX laws do. And so what this does is it gets as close to that ideal definition of consent, the social contract consent that we desire and need in our nation. And there's a lot of debate about it. From what I've read, it's a very alarmist debate. And let's see if I have a polling question. Do I have a polling question after that? Did we decide? Okay, it's somewhere. Oh, how do I, how do I, oh, can they see it? Mm-hmm. Where do I see it? At? I'm sorry, I'm just trying to see what I'm asking people.
Does your state have an affirmative consent?
Okay, I am not seeing. Oh, okay. So I want to know, of the people who are on right now, does your state have an affirmative consent law? I'm curious. And so the poll is open. Some people do, some people, looks like a lot of people are not sure. Okay, well, that website can tell you, the RAIN website. So I have one more polling question, and that is, if your state does have an affirmative consent law, is it helping you? And I know yes or no is probably insufficient for answering right now, but I would love to know if you feel like there's a positive outcome from that. And I think we need another webinar because it says, no, it does not seem to be helping. Well, we probably need a lot more than a webinar. Okay, let me put this back away. I am bringing back to you a slide that you should be familiar with. It is the slide where I break down our idealistic version of consent, the thing that we want. This is the Fry's consent, but really kind of thinking about how power is working in the legal definition of consent, which is on the right side, and the like this idealized version of what we want. We want people to have agency and autonomy. And I was thinking about how that it's so complicated because consent has to be, it isn't just a one-way street when we're talking about sexual consent. And so something that I added to this argument was that something that I left out last time is that in this act of ethical, idealistic consent, power is shared through that exchange of consent. And I think that that is really kind of radical, loving, ethical way of being with other human beings. And it doesn't have to be sexual in nature, just because we're talking about sexual violence prevention. I wanted to bring it up. Maybe I'm stuck. The slide isn't advancing. Am I being impatient? I'm probably being impatient. Should I press escape? Maybe?
I think it's don't press escape.
Don't press anything. Just while we're thinking about it, okay. I have a slide in here. So what I wanted to do to add to the conversation that we started around consent in webinar number 2 is how do disability services and advocacy agencies that are serving people with disabilities for things throughout their day, how are those people just looking at sexual consent, determining, like, how are they implementing consent in their agencies? And so I have a couple of slides about this, and I don't think that you can see them, so I'll just go ahead and what I wanted to say is that I think that I need to stop now and ask Haley. This is Haley's. I'm so sorry. Okay, Haley, you're on. I'll advance the slides for you.
Hi everyone, my name is Haley Sumner, and currently I am a senior at Butler University. I'm so sorry that I can't be visible. My technology wasn't quite cooperating with the webinar, and unfortunately I wasn't able to be with the wonderful fellow presenters in Muncie today, but I'm honored to be a panelist. And so just a bit more about me. I am speaking from the perspective of a white, visually impaired woman who is a survivor. And so going off of that, I thought that it was very important, now that we have the background on disability justice, and now that we understand this consent and the varying laws in our states that surround that, I thought that it would be beneficial to discuss some of the misconceptions that might be presented in certain conversations or interactions that surround the intersection between disability and sexual violence. And going off of that, how do we combat these misconceptions throughout our day-to-day lives, while still being able to show hope, optimism, and empathy for those around us. So for I feel like one of the first and one of the common things that's heard is that there's already a high risk of vulnerability as people with disabilities, and whether that, especially if the disability is more visible. So I feel like it is an unfortunate commonality that if survivors share their stories, or if there are conversations surrounding sexual violence, then the differently abled population, I feel like a very common thought would be, oh, well, they're already vulnerable already, so this increases that vulnerability. How sad, how like what a shame. And so I feel like a way to combat that would just be to kind of just approach the conversation from the standpoint of being willing to educate and advocate, but also just explaining the truth that no matter who you are, sexual violence unfortunately can happen and does happen despite different ability, despite appearance, despite other qualities that we as humans possess. So I feel like going off of that, one of the, I feel like another common misconception or common theme that others might say as a way to, I think, establish like encouragement or establish empathy are comments like, oh, you're so smart. I can't believe, like, how could something like this happen to you because of your intelligence? Or something to the effect of, oh, well, you need to be more cautious or more careful. So I think while comments like these are definitely understood, I think from the point of view of whoever is being honest and vulnerable and sharing their story, or sharing the importance and the prevalence of the issue of sexual violence, comments like these, as hard as it is to say, might be a bit off-putting, or might seem confusing, or maybe even a bit discouraging to the communicator at hand. And so I think attempting to establish, again, that empathy and that understanding. One misconception that I have personally struggled with in past, and even still at times when I am sharing my story just as a way to spread awareness, is as someone who has a service dog, and when I'm discussing with other people who are aware of this, they might say, oh, well, what did your service dog do in this situation? Or why didn't your service dog react or attack? And I think one of the common misconceptions about those who have service or therapy or other animals that provide healing and encouragement and support in different areas are that those dogs are trained in, like, that all dogs are trained to attack, and all dogs are trained to be aggressive when their handler or their companion is put in danger. And while this is definitely true for certain cases, not all dogs, especially for the purposes of guiding for those who are visually impaired or blind, are trained to do this. So I feel that personally, and I can suffice it to say that for others too, is when some might kind of use our service dogs as almost just a questionable method that this could have been prevented if they would have stepped in. Definitely, unfortunately, isn't true or really isn't their responsibility. So I figured that since this is centered around disability, that was definitely a great point to bring up. I think also just the final probably one of the most common misconceptions that I've heard. Oh, sorry, my slide got a bit out of whack. But the last misconception that I've heard has, why didn't you tell me sooner? Or kind of going off of that, the question of so-and-so, or like there must be something else wrong. Like you must be too like you must not have understood your surroundings in the situation to have been able to prevent it, which I feel kind of goes off of just like the common idea of prevention, and how like it's my hope that through these webinars and through my continued advocacy, I'm able to just spread ideas and spread ways of the prevention, but also being able to realize the unfortunately that at the end of the day we can try as much as we can, but just being okay and being able to understand when these things do happen, and being able to support survivors after going through a traumatic experience such as sexual assault or violence. So I know I touched on this next. Actually, before I continue, Sky, could you move the slide?
Yes, we just moved.
Wonderful. So I know I mentioned a few ways that those misconceptions that I mentioned previously can be combated, especially when we're in the midst of conversations and might not be certain of the best or most appropriate things to say, when our stories and our honesty might be challenged. So I feel like a very important tactic to do at first would just be to meet the individual where they are by expressing like your understanding for why they may have asked that question or made that comment. So say if someone were to make the comment of, oh, why did your service dog not respond? You could say, well, I understand why this question is on your mind because of the role that service dogs have to assist and guide their companions in diverse ways, and then explain that like the dog wasn't trained for that, or something along the lines. If they would bring up a misconception that was different than that, I just use that as an example. But I think the second way that we're able to combat is just use hope and optimism. So kind of explain your stance, but also from a perspective of just being hopeful for this topic that is very hard to discuss, and along the same lines, being as optimistic as possible, just as a way to kind of indirectly support oneself, the person with whom you're conversing or interacting with, and fellow survivors around the world. I'd say, kind of going off of that, I always like to kind of bring up the fact of inclusivity and just making sure that through these conversations, your language is inclusive of all, and it's not like placing like any direct stance on one certain person or one group of people, or like placing blame on a certain minority. And then for fourth, I always like to kind of intertwine just advocacy and education here. And so just while these conversations are very difficult, and while it's very hard in the moment to sometimes know exactly what to say or how to respond when sometimes we are confronted with some misunderstandings or just misinterpretations after discussing these topics. I would say just know have like a frame of mind that through this you are not only advocating for survivors and the world of sexual violence as a whole, but you're also educating through that. And so you never know, like you could be encouraging someone to spread awareness or to create like sexual violence workshops for like to benefit those in future. So you never know where these conversations might lead in a positive direction, and you never know how like what you might be saying or the points you might be making might be a step in the right direction for advocacy and education going forward. So thank you so much. I think
Appreciate your point of view. Move that down. And eventually, slide. Look at that. Thank you. I wanted to let you know how disability services and advocacy agencies are looking at consent, sexual consent, and how they're thinking about it, and how is it that they are helping people figure it out themselves. So one of the things that I have learned is that even if a person has guardianship, the capacity to consent to sex is always assumed, and it is understood. That means that disability services agencies are presuming that people have the right to make sexual decisions, and they are acting on that presumption. It can be a dangerous dance for an agency to move forward on helping someone gain capacity to make sexual decisions if they don't know that their guardian is or is not cool with it. But what I've noticed is that most agencies are imbuing decision-making agency on the person with disabilities and not going to somebody else first, which I think is great. But it's one of those weird ethical conundrums where, are you an advocate right now, or are you doing what the person wants and needs, or are you following the law and needing to go to the guardian because the guardian is the one that makes decisions, that kind of thing. So I wanted to break it down a little bit and talk to you about what it is that disability agencies are looking at. And really, it's very simple. They're looking at capacity, which I should have written after bullet point 1. Can this individual evaluate the context and what is going on and the outcomes from the activity? And can they make knowledgeable decisions about that? Meaning, do I know if I have penis and vagina sex without a condom that I could get pregnant or diseases or something, that kind of thing? So that goes to capacity, the capacity element in the legal definition of consent. Bullet point number 2, this person should have knowledge about sexuality and sexual sexual identity and the contexts in which sexual behavior is okay, and also how the human body works, what is all involved, and what happens when you combine different body parts and fluids and things like that. So that goes to the question of competency. And the final thing that I think we leave out of these discussions, because it's not primary prevention, is this person should be able to discuss a plan for what might happen on pregnancy or diseases or something like that. And this person should be able to recognize coercion, which is less easy. They should be able to recognize abuse when it happens. And it is because of all of these elements, which contain pieces of the social sexual consent contract that we talk about and the legal consent contract, that adds barriers to people with disabilities in achieving sexual consent. So one thing that I wanted to point out to us is I had been looking at this from a space of negativity. And what I did last night is I just really looked at this for the first time, trying with new eyes, and realized what a magnificent way of being this actually is. So for people with disabilities who receive institutionalized services, they have an entire team of people who are going to help them not only become competent, but grow the capacity to be competent to make sexual decisions as part of a supported decision-making process. So these are people often that, ideally, these are people that the person trusts and wants to be involved in these conversations, but they're frank, open, honest conversations, which no other business situation, I think, would have. And so prior to any kind of sexual decision-making, people are developing capacity and competency, and it involves teams of people who know most of what there is to know about services for a person with disability. So it involves a team of people who work together to help that person understand both the risks and rewards in sexual decision making. And I spent years thinking, gosh, this is so invasive, and who the heck would want to sit around a big table with a bunch of people talking about consent, or like making a plan for your sexual activities? And I thought, what if we did that and it was normal, and we encouraged each other to do that? And what if we talked about it? What would happen to the shame? So many questions. So actually I'm on the pro side. We should talk more about this and have more people involved in these decisions with us. So I wanted to offer the sexual violence preventionists out there some tools to take a look at and break down these elements of consent that we talked about. One of the things that I want to offer to you is having helped a few agencies, only 3, so I do really mean a few, implement healthy relationship and healthy sexuality classes. It is always really, really important to pre-screen people for sexual trauma. I wanted to ensure to put that in there because a lot of people are like, yes, let's learn about the healthy thing. Let's learn about how we can make great sexual decisions. And people get triggered and re-experience trauma. And so there is a lot of pre-work that needs to go into classes like that. And I've provided for you 2 tools that I think can help practitioners, help disability services agencies, if they're not already doing this, take a look at consent. There's these free tools, which I highly recommend that you look at. And so it has a lot of really great information that the very expensive tool right below it has. It's called the Verbal Informed Sexual Consent Assessment Tool. That's the VISCAT. And I think it is worth it. It's gotten way more expensive recently, and I would recommend that you check out the author before you spend money. I have seen the tool and I have seen people use the tool, and it's great. However, I would support the folks in that free capacity assessment for sex tool, and also the people at Sexuality and Disability Consortium, excuse me. They have tools that were created by people with disabilities for people with disabilities, and then they worked with researchers to write about it. And so you can Google those two Sexuality and Disability Consortium tools, and also reach out to us if you want to talk about any of the ways that these things were implemented. We are at ICADV working with some agencies around healthy sexuality policies for residential services for people with disabilities. And so I feel like I could probably go on and on forever, and we're gonna move on to the next, I believe connecting the dots might be next. Okay. And so I believe I am switching out.
Hi, it's Sky again. I'm gonna go through connecting the dots really quickly because everyone will have access to the slides at the end of the webinar as well. But before I do that, Sierra actually reminded me of something that we really haven't discussed in any of the webinars, and I just wanna make sure that it's in here somewhere. And that is to say, particularly since we haven't really done a lot of work around actually educating on or discussing disability or chronic illness specific safer sex, that I just wanted to mention a quick point that I think very often there is a perception that folks who are in monogamous relationships or committed relationships of different kinds, or basically people who have consistent partners, are not at risk for sexually transmitted infections if they're in that stable relationship. And I just want to mention, like, for folks who are chronically ill or immune suppressed or immune compromised in some way, that you either can still risk getting sick yourself, even if it's not traditionally something that's considered an STI, or if you're someone who routinely does, get pathogens or is even like a common carrier for different things, that you can also like make each other sick. And so I would still advise people to, even whenever folks are in either monogamous, committed, or consistent partnerships of some kind, that folks take time to really like figure out for their own health needs what safer sex means for them. Okay, connecting the dots very briefly. This section is basically addressing what are the different areas that connect to disability justice. So one of the things is food security. So I have all of the sources linked at the bottom of each slide related to the topic. So one of the things that I found really shocking was 1/3 to half of young adults with disabilities have experienced a lot of food insecurity in this particular study that we were looking at. And that's in comparison to only 13 to 15% of young adults who don't have disabilities. And so just to mention that, like addressing things like food security could really drastically also impact and prevent violence against people with disabilities, because the person is less likely to be in a compromising situation or a situation where they're dependent on someone else in a way that may not be healthy or make them vulnerable to different types of violence. And also another connection from a different study is that the study found basically that both folks who have disabilities and those who don't, if they are food insecure, they are more likely to have poor health, whether that's physical or mental health. And so just by addressing food security, we know that we are more likely to also ensure that people have access to the forms of health care that they need. Something that I think people often take for granted in places like the US, but is not actually a resolved issue, is clean water and access to sanitation. So first off, I was really shocked as I was looking for research on this topic to find that there's actually no large-scale assessment of whether or not people with disabilities have access to clean water and sanitation. Like, it's such a low priority issue that this topic has not been funded in a really big way. People have found that generally, in terms of actually a worldwide survey, they found that 4% of worldwide deaths and 10% of all worldwide disease is actually directly connected to lack of clean water, lack of access to sanitation like plumbing, and lack of access to fulfilling the person's hygiene needs. And just thinking like such a simple thing as like making sure people have access to clean water and sanitation could drastically impact such a massive amount of people across the world, and that it's very likely, given what we know about all the different intersections of people with disabilities experiences accessing basic needs, that just addressing clean water and making sure people have access to sanitation and hygiene needs would really drastically impact people with disabilities. There's several surveys related to financial and employment security. And, Sierra already mentioned that there is currently in the US a federal law that allows employers to pay sub-minimum wages to people with disabilities, that young adults who have disabilities, even those who are on Social Security disability and just Social Security, often still have higher levels of food insecurity than their able-bodied peers. And they also found another study that they did a really cool systemic review of 122 high-quality research studies. You can actually look at their methods for how they determined what to include. But they found that 81% of 81% of the studies they looked at, those 122, showed a clear relationship between disability and poverty. And that's not to say that disability means that people are more likely to, inherently not be able to be financially stable. It's more of an indicator of all of the systemic problems that people with disabilities experience that make it harder for them to exist in the world in the ways that they can and that they need. Some additional areas that we really didn't talk about are, additional areas of unmet or undermet needs are access to transportation, access to physically, emotionally, and financially accessible and stable housing, access to appropriate health care and insurance, and self-determined quality of life, which we've talked about a few times in this series. Just basic access to safety, access to social connections, which Sierra talked a lot about in one of our previous webinars, that often people with disabilities are at a significant disadvantage in having social connections and the breadth of social connections that able-bodied peers have. And then actual access to service animals and other disability support tools, because very often those are left up to the individual to find a way to pay for. But as we just discussed, people with disabilities are disproportionately underemployed and undersupported financially and in other ways in their life. Okay, so the last section is going to be with Jody and Andrea, and I'm just going to tilt the camera in their direction.
All right, I guess I'm first. I'm Andrea Mann. I am the mother of 3 children. All 3 of them have disabilities of some sort. My oldest has a genetic disorder called neurofibromatosis. She has some learning disabilities, and was adopted. And she actually is Black, so we have transracial adoption there. My middle child is also adopted, and she has Down syndrome. She's hard of hearing, she has epilepsy, she has a G-tube, and then as a result of multiple medical issues in her first year of life is unable to walk unassisted. G-tube, sorry. G-tube is a gastro tube that goes into her stomach to help with eating or drinking, for people who can't eat or drink safely. Epilepsy, hard of hearing, so she uses ASL as her main means of communication, uses a wheelchair or walker in a wheelchair most of the time. I think that's it for her. There might be more, I don't know. And then my youngest is a biological kiddo who was born with congenital anomalies in his spine and ribs. So he has scoliosis, he had some genitourinary defects, spinal cord defect, so he's had a few surgeries. He has a congenital heart defect, he has growth hormone issues, and so he gets growth hormone via subcutaneous shots every day. So I think that's basically our exciting life, that when you put it all together at once sounds way more overwhelming than what our days really probably are. And so for me as a parent, I actually was sexually assaulted multiple times growing up before my 18th birthday. And so going into parenting at all for me meant making certain that I had all of the information I needed to try to help give my children the tools to know their bodies, know what consent is, and prevent in whatever way is humanly possible anything from ever taking place that they did not give consent to. And so once my middle child especially is probably my most vulnerable. She can't go to the restroom alone. And so once those statistics come out that somewhere around 90% of people with disabilities experience sexual abuse at some point in their life, and having a child who's basically nonverbal, not great at answering yes, no questions. She can tell me things. She can tell me she wants to eat. She can tell me she needs to go to the bathroom. But if I said, what did you do at school today? There wouldn't really be much of an answer. She'd probably tell me Sesame Street because she just wants me to stop talking so she can watch Sesame Street. And so someone takes her to the bathroom multiple times a day at school. Just things that I have always felt more and more like she can't tell me if something happens. So for us as a family, it's important to know the signs. I doubt that I would say this to her teachers or she has a one-on-one aide, but I actually, when I'm changing her at home, if she has an accident, do a lot of like once-overs of physically looking for any signs of bruising anywhere, whether it be sexual or just someone grabbing her too hard, those sorts of things. So just researching on my own what might physically show up, or even what might changes in behavior that we might see if something were to happen to one of our kids who they were unable to tell us. And one of the other big things that that's made our family sort of laugh, but because she uses ASL, we learned very early what the signs are for penis and vagina and taught them to our children. And so my youngest son, before he could talk, would sign the word penis regularly at the doctor when she was checking him, or after he had surgeries and stuff. And they always, what is he doing? And I was like, well, he's telling you about his penis, of course. And so it's something that we're kind of proud of, but also that's something that lots of parents probably don't think about for a nonverbal kid, is making certain they have the language for the body parts that a verbal child would have. If I'm going to tell my oldest child about her vulva and her clitoris and her vagina and her anus, then I need to make sure that my child who can't speak also has those words, whether she uses them or not. So for other parents and caregivers, I would say the same thing. Watch for signs, know the signs, research the signs, watch for changes in behavior. Go with your gut. If you feel like your kid is scared of someone that takes care of them or is starting to act differently, look into that more. And don't assume that your child's just off or having a full moon day or any of those things. Really go with what you feel like might, if there's something else going on. Teach your children about consent. Another big thing for our family is assume competence. So whether they can give it back to you or not, whether you are certain they understand or not, continue to talk to them about it and teach them about it, because it's possible they're understanding way more than what you realize, and it could come back and help them either prevent something for themselves or be able to tell you if something happens, be able to give you some of those signs. Okay, ways we can contribute to advocacy as able-bodied people. Get connected with disability advocacy groups such as ARC, MAMI, and ADAPT. Involve people with disabilities in decisions that affect their lives, giving them power in the parental outcomes. And you can start doing this very, very early with things that might feel really silly. My little kid, she, once again, is just the one that this applies to the most. She doesn't care about what I put on her, what her clothes are. She couldn't care less. But still being able to say things like, which shorts would you like to wear today? And which shirt would you like to wear? would you like to walk with your walker, or would you like to use your wheelchair today? Just teaching them early how to make decisions about things that maybe don't matter, so that when things that do matter come up, they have those abilities already. And add funding to budgets for accessibility and accommodations for every program, service, event, and building project. And this sometimes means being really, really obnoxious to people who have the funds if you don't, and doing it anyway because it's what's best for everyone. Okay, vote for lawmakers who will address issues related to basic needs and well-being. Yes. Advocate for sexual autonomy across the lifespan. This one's huge for me. Even just going back, talking to them when you're changing their diaper. When the doctor, it's okay for the doctor to look at this. I'm here with you. This wouldn't be okay in another situation. And it might make the doctor uncomfortable that you're explaining it to them in front of them, but just, especially for kids who can't tell you things, making certain that they understand in every situation where their autonomy lies. And for our middle child especially, there's a lot of kids at school she loves to hug. A lot of kids at school that will come up to hug her, and I will tell them, you have to ask her first. Her body, her choice. Or they'll say, she pushed me away, and I'll say, that's right. She's telling you no. That's her body. That's her choice. She doesn't have to hug you. And the same is true for giving other people hugs, teaching her, like, no, you can't just go up and hug people or smack people, which is what she really likes to do. Those are their bodies and their choices, and if they say no thank you, then we're going to respect that. And advocate for healthy sexuality policies and disability service providers, agencies, and schools. And this is just a huge one that I feel like Sky did a great job of touching on. Or not Sky, I'm sorry. Sierra did a great job of touching on, of knowing, having hard conversations, knowing what agencies you're hiring, knowing that they're willing to have those hard conversations, and even yourself being willing to have hard conversations with your kids. And I will tell you, my oldest kid is a question asker. And we recently had a conversation about consent and sexuality, and why there happened to be a girl at her school that got pregnant very young. And she said, I didn't think people could have sex when they were 13. And I was like, well, actually they can, clearly. And so we talked more about what that looks like, and why maybe that 13-year-old was involved in that choice and maybe she wasn't, and what it looks like to be in a healthy sexual relationship, and that it's supposed to be enjoyable for everybody. It's supposed to be something that she had a choice in, and what things in her life may have played out that maybe she didn't feel like she had a choice, or maybe the guy that she was with didn't feel like he had a choice, kind of thing. So being willing to have it, and she's 10, so this wasn't like a 15-year-old conversation. Being willing to have conversations really early with whatever questions are asked, and being honest and open with the things that they need to be able to make those decisions as they grow older and want to make those decisions.
Okay, Jody.
Hi everyone.
Hi everyone.
I'm Jody Powers,
I'm Jody Powers.
and I am an independent disability consultant.
And she is an independent disability consultant.
Yes, and I have cerebral palsy.
She has cerebral palsy.
Yay!
Yay.
And I also have a diagnosis of chronic depression.
A diagnosis of chronic depression.
Yes.
Okay.
Before I go into what I'm going to go into,
Before I go into what I'm going to go into,
I want to explain and the risk of his assume that if a person with a disability is depressed, it's because of no disability.
I want to explain the idea that if a person with a disability is depressed, it's because of their disability.
That is not something that is the common belief.
Okay, not assumption, the common belief that if a person with a disability is depressed, it's because of their
Yeah.
disability.
And that is not true. When someone party, I mean, causes the presence of two different disabilities.
That is not true. My cerebral palsy and my chronic depression are two different disabilities.
Of course, it is true that you play off of one another.
Of course, it is true that they do play off of one another.
However, if I was not born with cerebral palsy,
However, if I was not born with my cerebral palsy,
I would have to have my chronic depression.
I would still have my chronic depression.
Yeah. That's your I your yeah you just said that to help us not to assume.
I just said that to help us not to assume.
Yeah. You let's move on.
Let's move on.
Yeah. And you read the slide?
You want me to read the slide for you?
Yes.
Okay. Ways to help people with disabilities feel welcomed and valued in your place of operation for service providers and professionals. Make sure buildings and parking lots are functionally accessible and not just ADA compliant.
They are two different things.
They are two different things.
ADA compliant means
ADA compliant means
is the bare minimum
the bare minimum.
of what the law requires.
The bare minimum of what the law requires.
This is not good enough, people.
It's not good enough, people.
No. I will give you an example.
I will give you an example.
Can I tell you how many times I go to a restroom?
I cannot tell you how many times I go to a restroom.
And it is accessible
And it is accessible.
because it has a bar in the car.
And because it has a bar in the stall.
But the car is not big enough for a wheelchair.
But the stall is not big enough for a wheelchair.
Tell me how you make that.
So tell me how that makes sense.
Is that it, right? Is that
It doesn't, right?
Is that when it really important for involve people with disabilities in the planning of
And that's why it's really important to involve people with disabilities in the planning of
everything?
everything.
Yeah, because the another example is
Say it again.
another example
Another example is
is the ADA does not require unlimited doors,
the ADA does not require automatic opening doors.
but really, if you really spend a lot of money on a new building,
If you're going to spend a lot of money on a new building,
a couple of more $1,000,
a couple more $1,000
it's not going to make a big deal.
is not going to be a big deal.
But it will make a huge difference in the lives of people with mobility impairment.
It will make a huge difference in the life of people with mobility impairments.
I mean, I have to be honest.
I have to be honest.
I know it happens to wait outside of a building
I don't like having to wait outside of a building
in the rain
in the rain
to have someone to look at me.
to have someone look at me,
Notice.
notice me,
And open the door.
and open the door.
I mean, yeah, that is not okay.
That is not okay.
And we're not.
It's really not.
when I go to a business
And when I go to a business
with an unlimited door,
with
an unlimited
with an automatic door,
that tells me that they welcome people with disabilities.
that tells me that they welcome people with
And I
disabilities.
want to do that now.
And I want to go back there.
I'm going to tell other people to go there.
And I will tell other people to go there.
Yeah. So next,
Make it a practice to ask all clients or customers if they need any accommodations in order for you to better serve them.
how awesome would it be if we just made it a practice?
How awesome would it be if we just made it a practice
I'm asking everyone,
of asking everyone,
what do you need from us?
what do you need from us
And only to better help you.
in order to better serve you?
And then that one, if the many disabilities are hidden
Because many disabilities are hidden
or invisible,
or invisible,
and it and it's not always easy to talk about what you need. You know,
it's not always easy to talk about what you need,
but to be able to have that discussion
to be able to have that discussion
in a natural way
in a natural way
would be awesome.
would be awesome.
This would be, yeah, it would just make your organization better
It would just make your organization better.
because you will be showing, you will letting everyone know
You're letting everyone know
that we value you.
that we value you.
Yeah. Hey, you did it.
So do it.
Yeah. Next.
Offer materials in alternative formats such as large print, braille, etc.
And that is self moment.
That's self-explanatory.
And then I remember about electronic format.
Unless
Electronic.
Electronic.
oh, and remember that was an electronic format.
Yeah. And then it's in the alternative.
This is an easy alternative.
Yeah. 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 Yeah.
Okay. Ways able people can contribute to advocacy. When hosting events, designate a team or a few people to assist with activities related to the events. Go the extra mile by hiring personal care attendants through healthcare agencies to assist with personal needs.
I love doing your conferences.
I love going to conferences
There are for on disability issues
that are on disability issues
because they did this.
because they get this.
They know that people may need help with the take home sound
They know that people might need help with getting their papers
or
out
moving a chair
or moving a chair
or the little thing.
or the little things.
And then they even have a tenant to help with restroom break.
They even have attendants to help with restroom breaks.
Yeah. So then, the amount what that one tell people with disabilities
Just think about what that would tell people with disabilities.
if you are both on this kind of assistance
If you offer this kind of assistance
and that we make it part of the norm.
and we make it part of the norm.
Yeah. I mean, and then it, when I go to other conferences,
When I go to other conferences,
I see the difference,
I see the difference.
you know, because it always more stressful for me.
It's always more stressful for me.
Yeah, I'm not able to be as involved
I'm not able to be as involved
because of that stress.
because of that stress.
And you miss out and I miss
And you miss out and I miss out.
on from that.
Have straws available because it is the little things that count.
Yes, I mean, I have to say
I have to say,
it really annoys me
it's really annoying me
that people are banning straws
that people are banning straws
because I need to drink.
because I need to drink.
Other people need to drink
Other people need to drink
with disability.
with disabilities.
What everybody people?
What are able-bodied people?
Why
Why are able-bodied people
have the privilege
having the privilege
to do it? To do it,
to drink,
but we don't.
but we don't?
I don't get that.
I don't get that.
I mean, if we tell about the environment,
If we tell about the
CAOE
care about the
environment,
environment,
then do away with all of it.
do away with all of it.
Kids, tops, toys,
Plates, cups, straws.
yeah, not the pet of people with disabilities.
It's not just
People with disabilities.
so it doesn't just affect people
Yeah.
with disabilities.
We just hold corporations accountable for pollution.
Is that it?
Yeah.
Is that it?
Yes.
Everybody we need that we are putting this on this disability community
It's really bothering me that we're putting this on the disability community.
and it's okay if we disagree on this point.
It's okay if we disagree on this point,
But telling you that and it communicating
but I'm telling you,
and communicating.
it's communicating
Their needs are not as important,
that our needs are not as important,
and they're not okay.
and that's not okay.
Next,
Use person first language unless you learn of other preferences.
and for this means, and I address myself as a person with a disability.
So this means I address myself as a person with a disability.
However, I have other become a people to see me as a person first,
Because I want people to see me as a person first.
but I have other friends who perform
I have other friends that prefer
and I'm a disabled person.
I am a disabled person.
Yeah. But it's always best to go with the people first anyway,
It's always best to go with the person first language
unless you find out otherwise.
unless you find out otherwise.
And the idea of all of this
The idea of all of this
is that we want to make people with disabilities feel like they are welcome
that we want to make people with disabilities feel like they are welcome
and valued.
and valued.
And that will help in the prevention of violence.
That will help with the prevention of violence
Because it will be more apt to be able to So, if there will be movement more active addressing issues.
because we will be more apt to addressing issues.
Yeah. So, thank you very much.
Are you all done?
Yeah.
Do you mind if I go to your final slides quickly?
I have more.
Yeah.
And then, no, I have more.
Okay. Create a needs assessment with PWD for PWD, people with disabilities.
And you for the rest.
Yeah.
See you.
Yep.
Okay. We're switching back just briefly. So I'm Sky again. I think the final slide in terms of ways able people can contribute to advocacy for service providers and professionals is creating needs assessment with and for people with disabilities. So that means not indirectly assessing people with disabilities' quality of life. Like, don't just ask questions of service providers, like actually involve people with disabilities in that data collection. Another thing is, having people with disabilities and disability-related agencies in the development, implementation, and evaluation of primary prevention initiatives. This goes back to the theme of, nothing about us without us. Track down data sources in your state that are inclusive of people with disabilities to make the case for equitable access to opportunities and resources. And if those state-specific information does not exist, extrapolate from national statistics and then advocate to actually create the state resources and state data collection. And then if you teach healthy relationships and sexuality, partner with disability agencies to ensure that people with disabilities are also receiving that information. That's particularly important because, as we've talked about in previous webinars, oftentimes people with disabilities don't gain access as children to healthy sexuality and safer sex education. And so you cannot just assume that adults who have disabilities have actually received that information or have had access to safer sex and healthy sexuality information. The last couple of slides have to do with creating institutional changes or larger scale changes, kind of like we've just discussed, making sure that data collection efforts, both as subjects of data collection and the investigators, include people with disabilities. We really, at the federal level, need to get rid of the sub-minimum employment wage for workers with disabilities. Making sure that everyone has kind of a shared language and understanding about sexuality and sexual consent, making sure that consent is actually defined through, in the affirmative through statutes instead of through its absence or lack of information, and then providing sexual health information for all humans across the lifespan, including accurate and culturally competent sexual health information for same-gender loving folks and people across many different sexualities and genders. We are pretty much on time to close. So what we're hoping is that if y'all will email us questions, we would be happy to give, answer questions in writing later so that, we were able to have time to go through all the things that we wanted to discuss today, because I think initially a lot of us thought that this webinar would not be quite so filled with information because we've had 5, but it ended up being the most full webinar. I have to say that I have thoroughly enjoyed this, and I feel like each of us has laughed more in this project. At least for me, I've laughed more in this project and had so much fun with the people that we've all worked with together. And so I think I'm going to leave you all with an autistic goodbye, which is a happy flap.
Happy flapping!
We're all happy flapping. Thank you all for joining us. Okay. Thank you all.